In other news, the only private hospital in Johor Bahru that allows MediSave to be used says it has seen patient numbers from Singapore double since the pandemic. 90% are women, mostly seeking maternity care. The only other hospital currently part of the overseas MediSave scheme is in Malacca. While it could mean healthcare is cheaper across the Causeway, at least one expert says there are many other factors which could mean higher overall costs. Sabrina Ng reports.
The Regency Specialist Hospital in Johor Bahru says it sees about 150 to 200 international patients daily, mostly from Indonesia and Singapore. As for those south of the border looking to use their MediSave, the process starts in Singapore, with the same withdrawal limits being applied. The Overseas MediSave scheme was introduced in 2010. Participating overseas hospitals must have an approved working relationship with a local MediSave accredited institution. Patients will first visit this institution for a clinical assessment, financial counselling, and to find out if they are eligible for MediSave coverage. A 2025 study found that cost savings range from 74% for in vitro fertilization, 24% for heart bypass, and 37% for knee replacement surgery when these procedures are performed in Malaysia instead of Singapore.
I would say that dollar to dollar is about the same, maybe 10% more, but in terms of currency, it's already 1/3. So affordability and accessibility are important. But when I look at the quality, I think it's also important because when you seek for healthcare, medical attention, cost is just alone one consideration, right? But more importantly is the quality, the safety, the accessibility of the doctors.
The hospital says most of its MediSave clientele are those choosing to give birth there, especially Malaysian wives of Singaporeans or new Singapore citizens who still have family members in Malaysia. While proximity and cheaper treatment are the main draws, one financial expert points out the other factors that make up the overall cost.
It consists of consultation, pre-op tests, the procedure itself, hospital stay, anaesthetist, specialist fees, medication, and follow-up visits, or even complications. So it's also important to factor in accommodation for each trip back, time off work, and also what MediSave and insurance will and won't cover there versus in Singapore. So don't compare just the sticker price, but compare the total cost.
And with the upcoming Rapid Transit System link, there is the expectation that cross-border healthcare will become more accessible, such as for low complexity treatment. Mr. Horn says it will be a growing supplement, not a wholesale replacement to Singapore's healthcare system. Residents will still choose complex, urgent, high-risk care in Singapore.